Hello, and welcome to our weekly COVID-19 update. The city and the county are working together to host a vaccine drive-through on Friday, January 15th from 6 a.m. through 6 p.m. or until supplies last at our local Brownsville Sports Park. The COVID-19 vaccine is free. You should not have to pay for it, and you don't need insurance to get the COVID-19 vaccine. The other reminder is important to get COVID-19 vaccine is because it helps to protect your family who are at risk, especially those over 65, healthcare workers, and it also gives you an improved protection for yourself. But you must remember to continue wearing your mask, social distancing, and sanitizing. And now I will pass this along to Ms. Jones, who will give us the rest of the update.
Thank you, Dr. Rodriguez. We had a couple of developments that came about last week that we'd like to notify you of this week. Occupancy level has decreased among our city. We have dropped our occupancy levels to 50%. In addition, Cameron County Judge Eddie Trevino temporarily decertified bars and similar establishments, which means at this point those individual businesses will no longer be open to the public. The Public Health Department is partnering up with the Brownsville Police Department and the Fire Marshal's Office to go out into the public and to discuss education about the occupancy levels and to enforce these levels to make sure that the safety of our citizens and our residents are of a top priority. And one of the questions that we often get asked is, why is it that we implemented, or how did we come to the conclusion that it was time to go ahead and decrease that occupancy level? And what's really important to know is that we're part of what they call a trauma service area, and we're V. And under the G832, if we have 7 consecutive days where 15% of our hospitalizations are COVID-related hospitalizations, that means that our healthcare infrastructure is actually hitting a crisis point, which means we need to do more mitigation strategies in order to protect that infrastructure and to ensure that our population has the best available healthcare available. And so once we hit that critical point, we did receive a letter, and it was okay for us to go ahead and start decreasing that occupancy level in order to protect our healthcare infrastructure. And when we protect our healthcare infrastructure, remember, we're also protecting, like Dr. Rodriguez had said, our most vulnerable populations, which are going to be those individuals that are 65 years and over, anyone with a chronic illness that leads to a severe outcome if they do get COVID-19. So that's why we've decreased the occupancy level, and we're out there educating our businesses and our population so that way they'll know what to expect and why we're doing that. We will return to the previous levels of occupancy once we have 7 consecutive days where our threshold is below the 15%. Until we meet that threshold, we are still considered in a crisis mode, and so we have to maintain the course in which we're on in order to protect our residents. So one important thing to always remember is that when we get our information, in order for us to be empowered and to be informed decision makers in our private life and in our households and as we're moving about, we have to choose authoritative resources. And in doing so, I'm going to provide you with a list of websites and entities in which you can kind of look into, because we don't want false information or myths to be circulated throughout our community. One of them will be the CDC. Always the CDC is an authoritative source. Also, the Department of State Health Services. They have excellent information for the community. Always consult the City of Brownsville website. We do have a COVID resource page, which is filled with excellent information, especially as it pertains to our community. Always visit BTX Cares. They have some additional information that is really valuable as we move along this pandemic. And then another thing that I kind of like to consult is also the Johns Hopkins University in Medicine and some of the other academia institutions. That would be like UT, School of Public Health, the School of Medicine, things of that nature. But we want to try to stay away from any of those Facebook or those memes that we see kind of circulating. We want to get the best up-to-date information so we can empower and inform our residents.
And I want to close by saying, be Brownsville strong, be safe, and don't forget to wear your mask, sanitize, and social distance. Thank you.